29-year-old John discovered a lump in his right breast. He ignored it. He thought it had something to do with weightlifting, and the lump enlarged, and he developed blood spots on his white t-shirt. He didn't think much of it, but it prompted him to go get it checked out. Some important things about John to consider: he did not drink alcohol, and he had a smoking history of 5-pack years. He was also an obese man with a body mass index of 3.5. After physical examination, it revealed that John had a 2.5, roughly 2.5 centimeter mass located in the inner quadrant of the right breast. He was referred out for mammography and ultrasound, and the findings reported that John had a 3-centimeter mass of irregular high density. The margins were not circumcised, and ultrasound also showed an enlarged lymph node in the right axilla, measuring 1.3 centimeters in diameter. He was referred out for biopsy, and it confirmed that John had invasive ductal cell carcinoma. PET scan results revealed no signs of systemic metastatic disease, but this case is rather shocking. Breast cancer in men accounts for less than 1% of breast cancer diagnoses, and about 1 in 8 women will be diagnosed with breast cancer. According to the American Cancer Society, a whopping 297,090 women and 2,800 men will be diagnosed with breast cancer this year in the US alone. Welcome to True Health Tuesdays. I'm Dr. Kennisha Reynolds, a naturopathic functional medicine physician and forensic scientist. One of my specialties is integrative oncology. In light of Breast Cancer Awareness Month, we're going to delve into all things breast health so that you can maintain healthy breast tissue. Breast diseases are very common in women. Non-proliferative breast diseases such as breast cyst, galactocells, and breast pain and fibrocystic breast lump. In fact, over 40% of women experience some kind of breast pain. And when we're thinking about breast health and maintaining healthy breast tissue, we want to assess risk factors. And the goal is to prevent cancer. Some of the risk factors for breast cancer that we should be aware of would include things such as family history, first-degree relatives, parent, sibling, child. If it runs in a family, it can be a risk factor. Highly dense breast tissue. Dense breast tissue is likely to, at some point, develop abnormal cells, and this can create breast cancer. Not to mention how difficult it is for imaging to actually pick up any abnormalities if there is a growing tumor. Highly dense breast tissue is another risk factor. Dense breast tissue has more cells that can become abnormal. Dense breast tissue also make it difficult for radiologists to identify any suspicious mass on mammography. Obesity is another risk factor. Obesity is associated with an increased activity of an enzyme called aromatase in breast tissue, which increases local production of estrogen. The larger you are, the more body fat you hold, the more estrogen you can produce. And everyone knows that alcohol consumption can be detrimental to your health. Even light drinking, 1 drink per day, is associated with an increased risk of breast cancer. Alcoholism is acetaldehyde, which is a known carcinogen. In fact, alcohol is considered a group 1 carcinogen. Alcohol can increase estrogen levels, and alcohol produces acetaldehyde, which is a known carcinogen. For that reason, you should avoid alcohol. The next risk factor, smoking. Now, we all can agree that smoking is not healthy, doesn't contribute to anything for the body. In fact, cigarettes contain 7,000 chemicals that have the ability to promote oxidative stress and tissue damage. For that reason, you do not want to smoke cigarettes because the chemicals can cause DNA changes, mutations, and that can lead to a breast cancer. Delay in childbirth. Yes, having babies is actually very protective against breast cancer. The older a woman is when she has her first full-term pregnancy, the higher her risk for breast cancer. Women who are older than 30 years old when they give birth to their first child have a higher risk for breast cancer than a woman who's never given birth. Full-term pregnancy renders the glands of the breast less susceptible to tumor development. And there's this thing about breastfeeding. Some women don't like breastfeeding, but lactation also has a protective effect against breast cancer, leading to a reduction of 5%. Some women may not necessarily like nursing baby, but lactation is protective against breast cancer with up to a 64% reduction in risk. So ladies, having babies and having them early and breastfeeding is extremely protective against breast cancer. The next risk factor is hormonal birth control or oral contraceptives. Oftentimes, these medications are prescribed for women who have hormonal imbalances, but rather than taking a medication that can disrupt your endocrine system, it's better to actually look at what's happening underneath. They can increase your risk for breast cancer. And oftentimes, these medications are prescribed for women who have hormonal imbalances. It's actually easier to take a deep dive into why you have hormonal imbalances and correct them rather than taking exogenous sources of hormones. That doesn't fix the problem underneath. And the next risk factor is, of course, the BRCA mutation. If you have a BRCA mutation, which is a mutation in a tumor suppressor gene, that can increase your risk for breast cancer. But I have hope for you. There are things that you can do to modulate that, to impact the expression of your BRCA if you do have the mutation. So when assessing breast health, screening is recommended. The common screening that most women do would include mammography, thermography, that involves looking at the heat changes to the breast and checking for any differences between the breast. And this can identify pathology. We also have bilateral MRI with and without contrast. We also have the ultrasound. And if there is a mass that needs to be biopsied, we can use fine needle aspiration. And then, of course, self-exams. When you check your breast every month, making sure that there's no lumps. And this is what screening entails. And it's really important when you're trying to preserve your breast tissue and monitor for any changes in your breast tissue. Now, this model can be very helpful in identifying any pathology of the breast. And it's usually recommended because you're screening for cancer, you're screening for pathology, and if you can catch it early. But this model fails to address the subset of patients who do not have cancer, but are experiencing changes in their breast tissue that precedes breast cancer. Women with benign diseases such as cyst, breast pain, fibrocystic breast are often told, we ruled out cancer, so your symptoms are normal. Folks, just because a vast majority of women have these symptoms does not make it normal. And oftentimes they say, you have these symptoms here, if it bothers you, take oral contraceptives or tamoxifen. Women are left with no solutions to their problems and are vulnerable to tissue changes that are happening in their breast that could be warning signs not to ignore. So maintaining breast health means paying attention to the signals. Maybe you've had a benign condition of the breast that's non-cancerous, lumps or fibrocystic changes. These could be warnings that the breast tissue is changing in an unfavorable direction. And you have an opportunity to change the disease course. Unlike the watch and wait approach, you can take action well before something develops and is detectable on routine screening. I'd like to give an example of a patient who went in for mammography one year, and they told her, we see something, but we're not quite sure what it is. So come back next year. And that entire year, she did nothing. They gave her no recommendations to follow that entire year. She went back the next year for her mammogram, and sure enough, the report showed that she had breast cancer. Perhaps lifestyle recommendations, dietary recommendations, recommendations on how to change her environment to reduce her toxic burden. Perhaps this would have changed her disease course, leading to better outcome, but that didn't happen, sadly. But here on True Health, I am going to equip you with the tools to help you improve your breast health, decrease your risk for breast cancer. And if you are one of those ladies that have had some kind of imaging that looks questionable, not quite fitting the characteristics for cancer, but there's something going on, this is for you. There's plenty for us to do as women to change our disease outcomes and reduce our risk. Here on True Health, we'd like to give you the tools, and we're going to start with the low-hanging fruit. So number one, staying current with breast screening is so critical. It is so important. Physical exams are very important, so stay current on those things. Consider early detection assays. One test to consider is Gallery. Gallery is a multi-cancer early detection test that detects over 50 types of cancers. This is something I offer to my patients, and it's incredibly useful. It has 99.5 specificity and a low false positive rate of 0.5%. Gallery is not intended to replace traditional screening, but is definitely something that you can add as an adjunct to the existing screening. You would be a candidate for Gallery if you have a family history of any cancer, or if you have the BRCA mutation, or if you're just one of those people who like to stay ahead of your health and prevent cancer before it develops. This is the test for you. What makes this test valuable is that it picks up cancer in the blood by DNA that's shed from tumor cells. Sometimes imaging cannot pick up everything, but with blood testing, you might be able to catch the cancer a lot sooner. Maybe you're a woman who's already had cancer. You're in remission, or you've just undergone treatment. Checking for early recurrence is also important. Signatera is a blood test that will detect cancer recurrence before it's detected on standard imaging. It's also used to assess a patient's response to treatment. If you've already gone through treatment and you've been told that you're in a clear, you can do Signatera blood test that will help to identify if the cancer is still present at a molecular level. In addition to standard screening and early detection, you might consider a nutrient assessment. Levels of 25-hydroxy vitamin D greater than 45 nanograms per milliliter is associated with a 45% decrease in breast cancer risk. Other nutrients that tend to be low in women with breast conditions includes EPA, DHA, or omega-3 fatty acids, GLA, magnesium. In fact, magnesium acts as a cofactor for vitamin D binding protein, and it supports metabolism of vitamin D into its active form. Magnesium levels need to be adequate in order for us to properly utilize vitamin D. Also, be sure to take your vitamin D with vitamin K2. Vitamin K2 is an essential vitamin that controls the flow of calcium in the body and therefore preventing calcification of soft tissue with vitamin D supplementation. In order to use vitamin D, you have to make sure you have adequate levels of magnesium, and you need to make sure that you take your vitamin D with vitamin K2. Checking for magnesium deficiency, checking for your omega-3 concentrations, checking for vitamin D. These are very important nutrients. Other nutrients that tend to be low in women with breast conditions include B vitamins, iron, and iodine. So you need to check these nutrients. Iodine deficiency contributes to breast cancer and its progression. Iodine deficiency is associated with fibrocystic breast disease, which can be effectively treated or prevented with iodine supplementation. Fibrocystic breast disease affects at least 50% of women of childbearing age and is associated with an increased risk of developing breast cancer. Molecular iodine has been found consistently useful in the promotion of breast health. Regular use of molecular iodine has been shown to reduce the sensitivity of breast cells to the proliferative effects of estrogen, resulting in healthy breast tissue. However, word of caution, talk to your doctors before supplementing with high iodine supplementation, and some people can worsen Hashimoto's and other thyroid diseases. If you have spotting in between periods, uterine fibroids, severe painful menses, PCOS, or even heavy bleeding during your cycles, it's a sign of hormone imbalance or estrogen dominance. Functional estrogen dominance can be due to low progesterone and or excessive exposure to xenoestrogens from our environment or poor hormone detoxification. So checking urinary hormone metabolites can be helpful for assessing imbalances and assessing for any hormones that might be in excess or deficiency. When it comes to breast health, assessing estrogen breakdown products can be of value. When estrogen is broken down into the liver, there are 3 routes that estrogen can take. One route is more protective than other routes, and we call it the good, the bad, and the ugly. The 2-hydroxy form of estrogen, so when estrogen is in our body and it goes through the liver, it can be broken down into a metabolite called 2-hydroxy. This metabolite is very protective. It has very little binding affinity to estrogen receptors. In fact, in a petri dish, they've been able to show that it decreased cell proliferation by 20 to 30% in cultured breast cancer cell lines. So that's encouraging. We know that when estrogen is broken down, it's the 2-hydroxy form that we want to preferentially push estrogen into. The next one is the bad. We have 4-hydroxy metabolite. So when estrogen is broken down, it can convert into 4-hydroxy. That is associated with an increased risk for breast cancer. It's more reactive and considered less safe. So we want to make sure that we're not producing a tremendous amount of 4-hydroxy metabolites of estrogen. And then we have the ugly, the 16-hydroxy form of estrogenic molecule that activates estrogen receptors, and it can create DNA mutations and induce proliferation of breast cancer cell lines in a petri dish. By 40 is the 16-hydroxy. It activates estrogen receptors and creates DNA damage, and it induces proliferation. The next form of estrogen metabolite that is extremely potent, and is actually the most potent out of the 2-hydroxy and 4-hydroxy, is 16-hydroxy. It's very potent in its ability to activate estrogen receptors, and it induces proliferation in cultured breast cancer cell lines by 40%. So this is quite concerning. And this form of estrogen we really want to eliminate. But overall, it's the 2-hydroxy we want to ensure that our estrogen is broken down into, and it's the 4-hydroxy, 16-hydroxy we really want to make sure we do not accumulate. It's important. The next important thing to do is to assess the hypothalamus, pituitary, adrenal, thyroid, and gonadal axis. These systems work together to maintain homeostasis of the endocrine system, and any endocrine disruption can contribute to the development of breast cancer or cancer in general. In addition to nutrient testing, it's important to check your hormones. Cortisol, checking cortisol levels throughout the day is very important in maintaining overall health. High levels of cortisol is connected to insulin resistance. It also shunts progesterone production. So when we have high cortisol, it can impact other hormones that play a role in maintaining our overall health and reducing our risk for cancer and breast cancer. in reducing our risk to breast cancer and any kind of cancer. Checking cortisol levels throughout the day is important for overall health and certainly important for breast health. High amounts of cortisol spikes insulin, creates insulin resistance, and it also shunts progesterone production. Balancing cortisol levels and adrenal health can improve dysglycemia. It's important to get these hormones under control so that you can mitigate the risks and you can also just improve overall health. Thyroid function is another one that's really important. The thyroid can influence ovarian hormones. Women with breast cancer are twofold more likely to develop thyroid cancer. And women with thyroid cancer have a 67% greater chance of developing breast cancer. So ladies, make sure to check out your thyroid, check out your adrenals, look at your cortisol levels, make sure to balance your hormones because these hormones do interact with each other and helping to protect the body against cancer and most importantly, breast cancer. In addition to standard screening, it's important to consider addressing breast health biochemically by targeting hormone metabolism, nutrition, and lifestyle factors. So we talked about hormone metabolism and hormone function and assessing urinary estrogen hormone and assessing urinary hormone metabolites, the 2-hydroxy, the 4-hydroxy, the 16-hydroxy estrogen metabolites, and other hormones. It's now time to look at nutrition because nutrition is the cornerstone of our health. When it comes to nutrition, first, you need to think about what things you have to remove from the diet. That's a must. For breast health, avoid red meat products. Red meat products contain DNA damaging chemicals such as heterocyclic amines that are produced when the meat is cooked at high temperatures. And what makes them very dangerous is that they're able to stimulate breast cancer cell proliferation almost as pure as estrogen. So these chemicals have estrogenic effects, just like the hormone estrogen that our bodies produce. And they can infiltrate the ducts where most breast cancers are formed. Heterocyclic amines have been shown to induce tumors of the breast, the prostate, and colon, and lymphoma in animal studies. Postmenopausal women with low fruit and vegetable intake, but high lifetime intake of grilled or barbecue or smoked meats, but high lifetime of grilled or barbecue or smoked meats have a 47% higher odds of breast cancer. Red meat consumption also increases IGF-1, a potent amplifier of estrogen receptors. So if you want to protect your breast tissue, avoid eating red meat and cooking red meat at very high temperatures due to the carcinogenic effects of heterocyclic amines on the breast tissue. Deep frying oils. Deep frying oils promote high risk of metastasis in breast tissue. Avoid frying, folks. It's very easy. The reason why is frying in oil creates oxidative stress because we're changing the chemical makeup and forming more toxic chemicals. And when we create more oxidative molecules that promote oxidative stress, it leads to tissue damage. And for that reason, if you want to protect your breast and improve breast health and reduce your risk for breast cancer, avoid deep frying in oil. What are the things you should eat? This is really important. Cruciferous vegetables. I talk about cruciferous vegetables all the time. They're a very potent class of functional foods that have powerful phytochemicals that can influence estrogen metabolism. Endolith-3 carbinol is a phytochemical of cruciferous vegetables that can induce the CYP1A1, a phase 1 enzymes involved in liver detoxification, and it can increase that 2-hydroxy. Remember the 2-hydroxy I talked about? That is what we want. We want to favor our 2-hydroxy pathway when estrogen is broken down. And cruciferous vegetables can aid in that. Cruciferous vegetables can also inhibit that 4-hydroxy, the bad estrogen metabolite. I3C supplementation has been shown to increase the 2-hydroxy in adults at doses 300 to 400 milligrams per day. So if you're having a problem with eating cruciferous vegetables, you can supplement with I3C, but be sure to talk to your doctor. Another powerful phytochemical inside cruciferous vegetables is sulforaphane. I talk about sulforaphane all the time. Sulforaphane is a potent inducer of phase 2 metabolism in the liver. Triple negative breast cancer represents the poorest prognosis amongst all breast cancer subtypes, with no available effective therapy. Triple negative breast cancer is a type of cancer that lacks estrogen receptor, progesterone receptor, and HER2. This means that the cancer is not driven by hormones. Most cancers can be easily inhibited by blocking estrogen and progesterone receptors, but not in the case of triple negative breast cancer. This makes it a very difficult cancer to treat. When solid tumors form, as in the case of breast cancer, cancer stem cells, also known as tumor-initiating cells, are released from the tumor. Cancer stem cells share several characteristics of normal tissue stem cells and have been identified in human tumors as possessing long-term self-renewal potential and resistance to chemotherapy and radiotherapy. This explains why cancer comes back a second time, or oftentimes is more aggressive or metastatic. There are no effective treatments available targeting cancer stem cells. However, there's an affordable, accessible, and more cost-effective option than traditional chemopreventative drugs. However, there's an accessible and more cost-effective option than traditional chemopreventative drugs. In a study published in the Journal of Cancer Prevention Research, scientists demonstrated that sulforaphane in cruciferous vegetables can inhibit cell proliferation and the formation of cancer stem cells in triple negative breast cancer. So ladies, there's hope for women with this dreaded disease or currently battling triple negative breast cancer. Just a little tip: before cooking your cruciferous vegetables, chop them and wait 20 to 40 minutes to allow the release of sulforaphane. Sulforaphane is heat stable, but not the enzyme myrosinase that releases sulforaphane. Chop it and wait in a bit before cooking gives this enzyme the opportunity to help release sulforaphane. If waiting is not an option, add powdered mustard seeds to the vegetable after cooking to increase the amount of sulforaphane in the food. If you have difficulty tolerating brassica family of vegetables, again, you can supplement with sulforaphane as you could with I3C. As our biological and chronic age increases, important tumor suppressor genes, the most common, the BRCA, and repair genes work less efficiently and can downregulate, giving rise to cancer. When BRCA becomes mutated, the likelihood of developing hormone-sensitive cancers rise exponentially. In fact, your risk for developing breast cancer, if you have the BRCA1 or BRCA2 mutation, your lifetime risk of developing breast cancer is 82%. Breast cancer risk by age 50 among mutation carriers born before 1940 was 24%. The good news is that 10% of breast cancer is due to genetics. But what changed between the 1940s and today? The environment, toxic exposure, dietary practices, agriculture, and stress. The list goes on. In fact, in vitro studies, have demonstrated that toxin exposure may contribute to silencing BRCA1. So definitely our environment influences epigenetic expression. But what if I told you there was a way to protect BRCA genes or even reverse the effects toxins have on BRCA? Micronutrients and nutritional bioactives with antioxidative properties help reduce oxidative stress caused by toxic estrogen metabolites. And these nutrients include vitamins A, E, C. We also have N-acetylcysteine, which is very powerful at helping it because of its antioxidant capabilities. Turmeric or curcumin, EGCG, lycopene, alpha lipoic acid, and flavonoids. These are potent nutrients that help to reduce and mitigate any oxidative stress that is caused from toxic estrogen metabolites. That 4-hydroxy I talked about, that 16-hydroxy, these nutrients can help quench the effects of these reactive estrogen metabolites. Resveratrol is the next nutrient. It is very powerful antioxidant and is found in all of our colorful fruits and veggies, our red and purple grapes, our blueberries, our cranberries, and more. It can, in fact, reverse the effects that toxins have on BRCA, which is amazing. However, it does have estrogenic effects, resveratrol. If you are a woman with a history of estrogen-sensitive cancers, such as breast, ovarian, and uterine cancers, it's important not to supplement with resveratrol, but rather get it from dietary sources. Resveratrol in supplement form exceeds the amount that's found in our fruits and veggies. And for that reason, it's best to get your resveratrol from dietary sources if you are a person who has a history of a hormone-sensitive cancer. EGCG is awesome of a phytochemical found in green tea and has been shown in one study, 3 cups of green tea per day was associated with up to 37% reduction in breast cancer and recurrence. EGCG has antioxidative properties as well as anti-carcinogenic properties against breast cancer. You don't have to drink green tea, but you can supplement with EGCG. Talk to your doctor. The next important food to consider to maintain healthy breast tissue is soy. Now, I know it gets a bad rep, but soy is important. Soy contains isoflavones that have protective effect against toxin-induced BRCA1 and BRCA2 expression. Soy isoflavones also modulate estrogen receptors and metabolism. In fact, soy consumption is associated with a reduced risk of breast cancer in postmenopausal women. It's also been shown to be effective against other cancers. It's been demonized because of the potential estrogenic effects of soy. However, it's well established that there are health benefits to consuming healthy, very well sourced soy. When sourcing soy, make sure it's organic, as most conventionally grown or as most conventional soy is genetically modified and is sprayed with glyphosate. Preferably fermented soy, such as tempeh, miso, tamari, natto. All of these are great options for soy. Another class of food that's important for maintaining breast health is fiber. Daily excretion of urinary estrogen metabolites is lowered by dietary fiber. In a pilot study of 45 premenopausal women at high risk for breast cancer, researchers found that administration of 2 tablespoons of flax seeds daily for 1 year resulted in fewer precancerous changes in their breast. And 80% participants had a drop in their levels of Ki-67, a biomarker for cell proliferation. So fiber is incredibly important. Inside flax seeds, a group of phytoestrogens that have weak estrogenic activity suppress the proliferation of breast cancer cells. Lignans are found in a variety of plant foods, such as flax seeds, pumpkin seeds, sesame seeds, soybean, broccoli, and some berries. In another study, women who ate more than 6 grams of soluble fiber per day, which is the equivalent of 1 cup of beans, had an 85% lower risk of breast cancer. Another study estimated every 20 grams of fiber intake per day was associated with a 15% lower risk of breast cancer. Mushrooms. High dietary intake of mushrooms is shown to decrease breast cancer risks in pre- and postmenopausal women by 64% compared to women who do not eat mushrooms. White button mushrooms are potential breast cancer chemopreventative agents as they suppress estrogen production and therefore mimic similar mechanisms as tamoxifen used to treat estrogen-sensitive breast cancer. Don't worry, if you don't like white button mushrooms, you can supplement with a mushroom powder that has white button mushrooms. A lifestyle practice that you can incorporate that can significantly reduce your risk for cancer would be fasting. Animal studies demonstrate that prolonged fasting positively influences cancer development and metabolic processes that are associated with risk and prognosis of breast cancer. Researchers from the University of California, San Diego, among other California universities, found that fasting for 13 hours a day may reduce the risk for breast cancer recurrence and death from the disease. In fact, short-term fasting may enhance anti-tumor effects of doxorubicin, a chemotherapy agent. In fact, short-term fasting may enhance the anti-tumor effects of certain chemotherapy agents, such as doxorubicin. Sleep. You have to get sleep under control, ladies and men, if you want to protect your health and protect yourself from cancer. All tissues of the cells of the human body are under circadian rhythm. In a region of the brain called the hypothalamus sits the master clock that regulates the physiology of the cardiovascular system, digestion, that regulates the physiology of cardiovascular function, digestion and absorption, the microbiome, pulmonary function, eating, sleeping behavior, and so much more. Circadian rhythms maintain tissue balance during the 24-hour day-night cycle. Circadian clocks play fundamental roles in cell division, DNA damage responses, and metabolism. Circadian disruptions have been proposed as a contributing factor for cancer initiation and progression. Acute sleep deprivation decreases DNA repair gene expression and promote DNA breaks and damage. Acute sleep deprivation decreases gene repair mechanisms and promote DNA breaks and damage. Did you know your breast tissue is also under circadian rhythm, meaning that healthy breast tissue performs certain functions within a 24-hour period? And when the circadian clock is disrupted, it affects the physiology of the breast, promoting abnormal changes in the breast tissue. Researchers at the University of Manchester compared breast tumors to normal breast tissue and found that breast tumors had altered circadian clocks compared to normal tissue. They also found increased tissue stiffness around the tumor. Altered circadian clocks play a role in the development and progression of breast cancer. Factors that disrupt circadian rhythm: shift work, jet lag, stand up late, the use of stimulants such as caffeine, irregular eating patterns, excessive eating, late night eating, lack of physical activity, avoidance of early morning sunlight exposure, and artificial light exposure at times when we're supposed to sleep. Exercise is so important. It helps to move and mobilize those toxic estrogen metabolites out of our body. 5 hours per week of vigorous aerobic exercise can lower estrogen and progesterone exposure by 20%. Exercise lowers circulating estrogen levels. Walking an hour a day has been shown to be more associated with significantly lower risk of breast cancer. And environment. We have to assess our environments, ladies. If you want to maintain your breast health, it's important to look into assess your environment for toxic exposure. Organochlorine pesticides can activate CYP enzymes responsible for producing that 16-hydroxy form of estrogen that we talked about. So if you have a problem with estrogen dominance, consider assessing your exposures to xeno. Consider doing a thorough assessment of your toxin exposure. It's really important for maintaining breast health. In a journal of clinical obstetrics and gynecology, Black women who routinely use chemical hair straighteners had a 2 to 3 times higher risk of fibroids out of the 7,000 women diagnosed. This is alarming. This is an example of how chemical exposure can increase your risk for hormone-sensitive conditions. And fibroids, if you didn't know, have tons of estrogen receptors. So assessing your environment for toxin exposure is really important for maintaining overall health to prevent cancer or any type of condition that's causing an imbalance, because these chemicals are known as endocrine disrupting chemicals. They can disrupt your hormone system and create problems. Chemical exposure from products used on the body, found in our food and water supply, or in the air that we breathe can promote changes to our physiology and initiate a cancer. And in this case, for Breast Cancer Awareness Month, we are talking about breast health, and these chemicals are known to facilitate the initiation of breast cancer. Ladies, take a look at your environment and make sure that you're reducing your exposure to xenoestrogens. Lifestyle, dietary, and environmental factors are major contributors to the development of breast cancer. In fact, 80% of breast cancer is due to environmental factors. Knowing this, you can now be proactive about addressing your modifiable risk factors to maintain healthy breast tissue and prevent breast cancer. Improve response to active treatment if you're currently undergoing treatment, or to remain in remission. Hopefully this information presented today is encouraging. Thank you for tuning in to True Health Tuesday. Be sure to click on the link in the description box for your free guide to breast health.